So what about root canals? You do those in your office as well?
We do. We offer root canals. You know, if a patient is in pain and it's not getting better, we're talking about a probable root canal. And so what we talk about with patients is, you know, you have an option to do a root canal, but root canals, you know, again, 5, 10, 15 years, we're talking about complications, retreats. And
so is a root canal like a dead tooth?
It's a dead tooth. It becomes brittle over time in a lot of cases.
Okay.
We think about, you've taken everything alive inside the tooth and taken it out. So what happens if something is dead over time, you know, and you put a crown on to strengthen it. And again, this is a good option for if you're not ready to replace your tooth. And we tell patients this, we're not against the root canals and the endodontists. So we think there's an option for that. But long term, if a patient doesn't want to go through that and doesn't want to go through the possibility of having to pay for a root canal and then 5, 10, 15, 20 years later, you know, pay for an implant and go through that process twice, you know, or go through the retreatments and the things like that. We offer, hey, we can get a root canal done, or excuse me, we can get a implant done and be done with it, okay? Now again, implants are great. There's less complications with them down the road than there are with things like root canals.